Hi there, welcome to Doc Talk. If you remember, Doc Talk is the podcast put out by the Knoxville Academy of Medicine where we talk about issues impacting us and our health in plain language. I'm Elise Denaney, former president of the Knoxville Academy of Medicine, and I am so pleased today to welcome joining us Dr. David Reith, who is a colleague for a long time, has practiced plastic surgery in Knoxville and helped so many Knoxvillians with how they feel about themselves and how they look. Today we're going to discuss breast implants, all kinds of breast implants, and hopefully we're going to be able to answer some of those questions that are running around in the back of your mind. So, welcome.
Thank you.
David.
Great to be here.
Good
to see you, Elise.
Yeah. Okay, so tell me about breast implants.
Well, breast implants have been around for a long time. And they've been sort of in and out of the news as they're kind of a topic that acquires a lot of attention. And as you know, many times there can be a lot of disinformation. I think the first thing one has to say about breast implants is that generally they are good devices, they are safe devices. They have probably been studied more than any implanted medical device, which is kind of amazing when you think that they've had more studies on them than perhaps a heart valve that you might have.
Right.
And they're basically two types, saline-filled breast implants and silicone gel-filled breast implants. And it's the silicone gel implants that have probably had the most development over the last 50, 60 years.
Right.
50 years, I would say. And different generations, which the gel is a little bit different, trying to improve the performance of the implant and the overall aesthetics of the implant for the women that have them.
So saline, just saline salt water?
Saline and salt water. Basically, both implants have two components. One is an outer shell, and in both it's a silicone polymer. One is filled with saline. You do that at the time of surgery. The other is pre-filled to a set volume with a silicone gel.
Do they feel the same?
Generally, the silicone gel implants feel more natural, because if you look at sort of what is the viscosity of a fluid as opposed to of a gel, it's more like normal breast tissue.
Gotcha. So I have been doing medicine for so long. I remember as a student in medicine that just like everything in medicine, it circles. One day it's bad, one day it's good, then we improve on it, and then we do the whole thing over again. So
It's not quite like fashion, but it's close.
yeah, it's like fashion. So silicone breast implants are now very, very safe.
Yes, they are. They have always been safe. There was a big controversy that developed in the late 80s, and they were taken off the market for a period of time. And depending upon what your opinion is about that, that was either a good precaution or a witch hunt. But suffice it to say that we have shown that these are very safe devices, that they have a good track record, and they have been used without any restrictions for the last 10 or 12 years.
One of my friends, bless her heart, she's always worried about when she gets her annual mammogram.
Are they going to pop my implant? Yes. I think every mammography center tells women with breast implants out of an abundance of caution that it's always possible that your implant could be damaged. I have yet to see an implant that has been damaged by just a mammogram.
Okay.
I did see one implant that had a needle biopsy where the needle got a little bit into the implant. Yeah, that was a problem. But other than that, normal mammography, you have to understand these implants are very, very resilient. You know, people ask, well, what if I fall face first? Is that going to damage the implant? And generally speaking, the answer is no. When implants fail, which is to rupture, the hole develops in the outer shell, it's more due to wear and tear. It's sort of like, the analogy I use is if you have your favorite pair of blue jeans and there's a crease, and after you've worn them for about 15 or 20 years, you're going to get a little hole in that crease. Right. That's the reason most implants will fail.
Okay. And when they do we just get a leak or?
Well, if it's a saline implant, your body absorbs the saline and you don't get a leak, you get a flat.
Okay.
With silicone, the gel just stays within the capsule. The capsule's a layer of tissue that your body forms around the implant. The gel just stays there and it's basically innocuous. What the most people are likely to notice is some increased firmness of the breast because the capsule may get a little thicker.
Okay. And so when we talk about capsule, we're talking about your body's reaction to just forming tissue around the implant?
Yes. Anything that is not biologically the same as you, your body is going to put a layer of tissue around. And we'll call it a scar, call it whatever you want. And that's a natural physiologic process. And it's generally not an issue unless that there's a lot of thickness to that capsule, then it can be a problem in terms of making breast implants feel firm.
Okay.
And that's something that we worked with a lot in terms of developing implants and techniques and how we put them in to decrease anything that might cause that capsule to be a little bit thicker.
Okay, so, all right, so if I'm thinking about having a breast implant, I'm going to come to you. I'm going to say I'd like breast augmentation, meaning I'd like augmentation of my breasts. And then what should I be thinking about?
Well, I think the first thing you said is right. You go to a board-certified plastic surgeon because we've dealt with this more than anyone else. You want to see a physician who has done a fair amount of these, who has knowledge of what they're doing. Talk to them about what your interest is, what your goals are. And I think one of the biggest decisions that you have, in addition to the type of implant you want to use, is the size of the implant. And I think that there are different ways we work with patients to get them to understand what they'll look like. You and I are both surgeons. We know that what we don't like is surprises after surgery. So we try to work through this with patients to make sure their expectations are achievable. We understand the expectations and we're planning to meet them.
We've been doing this for so long.
We won't say how long.
I remember the days when women went to the store to buy feminine hygiene products, and there would be 2 selections. And recently I went, and there was an entire aisle, and I went, oh my goodness. And it's that way with breast implants.
Well, to a degree. I think that there are 2 major breast implant manufacturers, and I would submit to you that one would be very hard-pressed, certainly with their silicone devices, to tell a major difference in one and the other once the implant's in somebody. So we've got very good companies making very good implants with good follow-up and good research. But within them, there are both saline and silicone, as we talked about. But the other important category or differentiation between the implants they make is those that have a smooth shell versus a textured shell. So the smooth shell is just as it sounds. It sounds smooth. Textured has sort of a roughness to it, and that varies from one implant manufacturer to another. These implants have been much more utilized in Europe, where they're the predominant implant that's in place, whereas in this country we are primarily using smooth implants.
Okay.
And interestingly, there's been a rare but significant disease which has been in the news lately, and we have found it to be associated only with textured implants.
Okay, that's the rough ones.
The rough ones.
Okay.
And it's something that a lot of people are concerned about, and I've had calls from patients, do I have the smooth implants or the textured implants? What do I need to worry about? And I think the bottom line is that the majority of the women in this country have smooth implants, and we really haven't identified any diseases that we can link directly to them. So I consider them to be about as safe as any medical device we implant. There are a few, very few women with textured implants that have had a problem with this disease, which is known as anaplastic large cell lymphoma, or ALCL. There have been about 600 women in the world who have been diagnosed with this, and we're talking about millions of women with implants. So it's very, very rare.
Okay.
But the good thing to know is if you have smooth implants, your risk of getting this is pretty much 0.
So if my neighbor is concerned, she had breast implants placed in 10 years ago, very happy with them, everything's good, nothing has really changed, but she heard the report on the channel, whatever news.
Right.
And she's concerned. What should she do?
Well, I think there are a couple things. The first thing, which is, and I'm very East Tennessee about this, and that is, if it ain't broke, don't fix it. Okay. There's not a compelling reason to do anything if nothing's amiss. But I think people want assurance. They want to know, well,
Right.
am I at risk for anything? And the first thing would be to be in touch with the surgeon that did the surgery and just ask what kind of implants do I have. Very simple. As you know, we have to keep records by law for 7 years, but most plastic surgeons who have patients with implants keep them for a lot longer.
Okay.
And that's a way of knowing what you have. Also, every person, when they have breast implants, should have been given a little card,
Right.
which has the serial numbers and the style numbers, and they could contact the manufacturer and just understand whether it was a smooth or a round implant.
That's great
smooth
because
injection.
I know I had an implant in my eye and they gave me a little card, and I lose cards all the time. So I tell them, take a picture and put it somewhere, in the cloud or something.
Yeah, I tell people you're not going to need this for 25 years, so put it in a place where we'll be able to find it in 20 or 25 years.
Right, because it's important medical data. Yeah. Okay. So, one, don't worry. If you are worried, because the risk is so low, but if you are worried, call your doctor, find out what kind of implant it was. Right. And then if they were to develop any kind of signs or symptoms.
The symptoms of this are pretty, and pretty much most of the patients that have developed this, and again, we're not talking about a lot of patients, is swelling, significant swelling, a long distance after the surgery's been done. That is 7 to 10 to 9 years.
Okay.
Just out of the blue, one breast swells.
Okay.
And for that, then you should seek medical attention.
Okay.
And that doesn't necessarily mean that you have this, because I've seen patients that have had some swelling and even have had to have implants removed, but they've not had this disease. So it's quite rare. It's it's kind of like getting struck by lightning, but by the same token, you don't stand outside in a thunderstorm holding a golf club in the air.
Right. I mean, just knowing what to do and what not to worry about is so helpful. Yeah. Okay, so let's see, final question.
Okay.
Is there any absolute contraindications? So people who really shouldn't consider having breast augmentation?
Well, if we're talking about elective breast augmentation just for cosmetic purposes, I think that pretty much everybody we can help out in some way. And I think the biggest thing is to figure out is what somebody's expectations are.
Good point.
And I think you have to talk and spend some time and understand, and sometimes talk several times, because it's a fluid process and expectations change along the way.
Yeah.
But the thing that's important is to make sure that what my patient wants is something that I can do for them. Because if I can't achieve their expectations, I can't give them what they want, either because they're asking for something I can't do, or maybe for whatever reason.
Right.
Both the patient and I are better off not going to the operating room together.
Yeah, I understand that. I mean, you can physically make somebody look better, but you're not the happiness doctor.
Right, but that said, you're absolutely correct, but the number of patients I have to say, I don't think that this is going to be a good thing, they're just not that many. That's which is nice.
It's so nice to realize mental health, when people feel better about themselves and you've achieved helping them to feel better about themselves. I think that the stigma of, oh, you're having something done that's just not relevant today.
You're absolutely correct. I mean, helping somebody have more confidence about themselves, feel better about themselves in the society in which we live, where some of these things are very important, that's great. It's very rewarding. It gets me out of bed in the morning.
Oh, that's wonderful. Thank you so much for what you do.
Well, thanks. Always great to talk to you about it.
Oh, thank you. Okay, so that's a wrap. That was Dr. David Reith. If we need to get a hold of you, how can we do that?
Well, I have a website, plasticsurgeryknoxville.com.
plasticsurgeryknoxville.com.
Yeah, we got the shortest one we could get.
Too many domains out there. Thank you so much for talking with us. We hope you will join us again for our next Doc Talk podcast. Have a great day.